What's up, everyone out there? My name is Jared Hall. I'm a physical therapist in Fort Worth, Texas, and I'm making this video because I've been reached out to by a lot of people and asked by some colleagues to put out a video about the idea of core stability and back pain in a really easy to digest format that's simple for the average person to come away having learned something new and hopefully changed their perspectives on how they think about back pain and how they think about the core and core stability. It's a really hot topic, and it's one that kind of has been accepted without a lot of questioning, except for those that are actually in the research looking at back pain and core stability. So I'm going to go through a quick presentation that kind of looks at some of that research and comes away with some real life take-home points to change the way that the average person thinks about back pain. So where did the whole core stability craze come from? You know, we've been chanting for a couple of decades now that if you have back pain, you've probably got a weak core, or you're unstable through your trunk or core, and you need to strengthen that up in order to get rid of your back pain. But where did that actually originate? So once upon a time, back in 1996, there was a researcher who is still currently a researcher, a phenomenal researcher, in fact, named Paul Hodges. And the idea that we needed stabilization around the spine was becoming somewhat popular. So what Paul Hodges did was he took a group of roughly 30 individuals, 15 of which had chronic low back pain that averaged about 8 years in duration, and 15 healthy individuals as controls. And he implanted little tiny fine electrical wires into the muscles in their trunk, and had both the healthy people and the people with back pain move their arm really quickly, raise it up in front and raise it out to the side. And what he did was he looked at the muscle activity in the trunk muscles with the rapid onset of raising your arm. And what he found out was that on the opposite side of which you raised your arm, because he only tested one side, the transverse abdominis muscle, which is one of your deeper core muscles or trunk muscles that is directly connected to the spine, and it's underneath your six-pack muscles, your rectus abdominis muscles, seemed to have somewhat of a delayed onset in its firings, you know, roughly about 50 milliseconds on average. In the normal healthy population that didn't have back pain, we saw that their transverse abdominis actually kicked on before that they moved their arm. And those people that had back pain for on average 8 years, their transverse abdominis actually turned on a little bit after they moved their arm. So his conclusion with this research was that the delayed onset of the contraction of the transverse abdominis muscle might indicate a deficit of motor control, and it could be hypothesized to result in inefficient muscular stabilization of the spine. So that's where the whole idea of your spine being unstable came from. I don't personally, and there's a lot of people that actually are into this research and have learned a lot more about it, don't like the term unstable, because your back is not actually unstable. Your spine is a very, very robust, strong structure. The discs in between the vertebrae are extremely strong, and they hold the vertebrae together. And in the absence of a really traumatic accident, the likelihood that your spine actually becomes unstable or out of place is next to nothing. It's extremely low. So what Paul Hodges was referring to here was muscular stability, that the muscles might not be working the way that they were supposed to. And he thought maybe this could be a cause of back pain. But the problem is, as we've come to find out through a little bit more research that we're going to look at, he might have put the cart a little bit before the horse, or those that were reading his research and kind of took it and ran with it before we knew a little bit more, put the cart before the horse, and made the assumption that the delay in the muscle firing in the transverse abdominis might cause back pain, rather than actually be a result of back pain. So this is where the core stability craze was born. This is kind of where some of the big ideas came from and propagated out into the physical therapy, the chiropractic, the personal training worlds, spinal surgery worlds. So some of this early research in the late 1980s and early to mid 1990s really sparked this idea of core stability. But should we just blindly trust this one study because it kind of made sense at the time? That's the beauty and the downfall of scientific research, is that we're constantly doing it to learn more and to prove ourselves wrong. We should actually be trying to prove ourselves wrong usually. So we are always constantly becoming less wrong and working towards what might be the right answer, even though we might not have the right answer. That helps us to develop theories. So this was a really good theory. It made a lot of sense, but we've done a lot of research since then that we're about to look at that actually might stand counter to what the original theory proposed by some of Hodge's research said. So let's go ahead and move on to the research, and I'll try to keep it really brief because I know that stuff is kind of boring for a lot of people. And we can see in 2008, wait a millisecond, a researcher by the name of Allison conducted a study that looked at the feed-forward response, or the way that the transverse abdominis muscle actually acted when you did movements. And he looked at both sides rather than just looking at one side like Paul Hodges did. And what he found was that the transverse abdominis muscle, which was originally thought to be a corset muscle that contracted together to create some muscular stability around the spine, actually functions independently. The left side functions when you move your right arm, and the right side functions when you move your left arm. So that muscle does act to create a little bit of bracing around the trunk and the spine, but it doesn't actually create this corset type effect that we thought that it did, which led to core stability. It's actually just an anticipatory movement that happens in your muscles when you go to reach out and pick up a coffee cup, or you reach up to grab something. So the idea of the transverse abdominis as a bilateral stabilizer needed to be revised based on this information. And this was 10 years ago, yet this is still the predominant idea. And if we move on into some of the other research, I've posted just a few studies here. So does the transverse abdominis muscle firing even seem to matter in those people with back pain? So if you look here at Vasseljen 2012, Allison 2012, Mannion 2012, and Wong 2014, we see that even though we can put people through trunk and core exercises, their onset timing of their muscles doesn't seem to change at all, yet they get better. Their back pain gets better, they move better, they feel better, they have better function, but nothing actually changes with the strength or the firing patterns of those muscles in their trunk. So it might be that the firing patterns and the strength of those muscles in their trunk are highly variable, and they might not actually be contributors to back pain, but changes in them might be a result of back pain sometimes. So that's a big uh-oh, right? If we've been promoting this idea that core instability or impaired core muscle firing was a huge reason for back pain, we should definitely see a strong trend to show that as back pain gets better, that core muscle activity also improves. Or if we can change the way that that core muscle activity works, we should improve back pain. Yet we see people get better in repeated studies despite no change in the way that the muscles fire around their trunk or their deep core muscles. So, okay, muscle timing doesn't seem to matter, but core strength exercises are still really good for back pain, right? So we're going to kind of say maybe yes, maybe no. If we look at research that compares core-focused exercises and core strengthening exercises to just a general exercise program for the trunk or for the lower extremities or even a walking program, we see that there's pretty much no difference in the long-term outcomes for people with back pain. So you can have somebody do core focused exercises, or you can have somebody do general exercises, and the act of exercising really seems to help people get better, helps them get out of back pain, even though we don't necessarily have to focus on the core. So we could say, yeah, core exercises work great, but so does a variety of other exercises as well. So core exercises aren't any better than anything else. And then if we continue on, we can see that Pilates, a lot of people are really fond of Pilates. I'm a big fan of Pilates as well. But when you compare Pilates to other general exercise for low back pain, it doesn't seem to fare any better. And if you know anything about Pilates, it's highly focused on the core and the trunk and maintaining a bracing position of the abdominal muscles. So it's highly core focused, yet it doesn't seem to be better than a general exercise program for helping people get out of back pain. And then if we go a little bit further and we look at what's called motor control exercises, those would be those exercises that work on the coordination of your trunk muscles and doing very fine movement patterns to try to learn how to control your transverse abdominis and all those different core, deep core muscles while you do activities. Again, doesn't seem to be better than general exercise for back pain. If we actually look at this big randomized control trial and systematic review posted in the Cochrane database, which is considered to be kind of the pinnacle of systematic reviews and research, we see that motor control exercise is probably more effective than doing nothing at all, but probably does not have an important effect on disability or pain in patients with chronic low back pain. It's not that it doesn't work, it's that it doesn't seem to work any better than anything else. If we move forward to some of the highly specialized core stability exercises, some of you guys might be familiar with a really smart researcher and professor from Canada named Stu McGill. Dr. McGill is a big proponent of certain aspects of core stability exercises. He proposes a lot of bracing activities, and he has what he calls his big three exercises, which are a modified curl up, a side plank, and a bird dog exercise. And when those exercises are compared to just conventional physiotherapy that includes a general strengthening program, again, they don't seem to be any better, even though they're highly specialized and highly focused to the core, to the lumbar multifidi muscles and the kind of corset muscles around the trunk and spine. So we're seeing this theme over and over again, comparing Pilates, comparing core focused exercises, the McGill Big Three, comparing motor control exercises around the trunk, comparing core stability and stabilization type exercises to general exercise, and we don't seem to see any big difference. They all seem to work. So that should make you step back and say, what's going on here? Maybe back pain is just a little bit more complicated than the muscle firing patterns of your deep abdominal muscles. Maybe it's a little bit more complicated than some weakness in your core muscles. In fact, there's some good research to show that during everyday activities, getting up, sitting up, standing, walking, you don't use more than about 4% of the maximum strength of your core muscles to do 4 to 8% to do all those activities. So you would have to be roughly 94, 96, 98% weak in those muscles before it actually affected the stability of your trunk. So the idea that core weakness causes back pain kind of really quickly starts to erode and leads to the question of, well, what does cause back pain, and why is this more complicated than we thought that it was? So let's actually look at some of the research that says what we do see and what we do observe in people in low back pain. You might notice that first name is Paul Hodges, about 13 years after his original study, and he showed that you actually see an increased amount of stiffness around the trunk and low back and spine of those people that do have low back pain. So that's kind of counterintuitive to what we talked about earlier with his idea that it was unstable because the muscles weren't working effectively. We actually did some follow-up research and saw that the trunk was actually stiffer in those people that have low back pain. And then we see Lameth 2002, Say 2011, Van de Hoorn 2012. We see a decreased variability in people's walking. So again, an increased stiffness or a decreased amount of movement and freedom and fluidity of movement during an everyday task like walking. We go to 2004 and we see increased muscle activity as measured by fine wire EMG and decreased variability in lifting with people with back pain. So again, they seem restricted into a very strict pattern of movement. And we see increased muscle activity and increased stiffness in those people with back pain. Then we move on to 2017, and yet again, we see less variability and more stiffness in various movements in everyday life. So it might be that we're seeing a change in these muscles around the spine because it's a protective mechanism because we already have back pain. So all these changes in the muscles are probably a result rather than a cause of back pain. So here's a wonderful quote by I can't say his name, but Carton Vibe Fearsome. He says, if people in pain walk like a walking plank, maybe we don't put them into a plank to work on their core to stabilize their back, because these people are already really stiff and they're already very stabilized because we have increased muscle activity and reduced variability in their movement patterns. They're kind of getting stuck in a rut, you could say. They're getting stuck in a rut that kind of facilitates pain and causes their system to be more protective rather than more free and flowing in their movement and confident. So here's a little quote, a little snippet of information from Peter O'Sullivan, who is one of the world's leading researchers in back pain. So I want to play this quote. It's taken from the Pain Reframed podcast, and I think you guys will enjoy it.
You know, we kind of had the Panjabi model of the neutral spine, and, you know, Panjabi was a smart guy, but he was a car engineer. And he kind of then adopted these engineering principles to the spine. But the spine, you know, it's not just a piece of engineering. This is a human being with thoughts and beliefs, and it's an organic system. So this kind of whole model of, you know, neutral spine, you know, you're vulnerable at the end of range, all this stuff was hugely part of our mindset and our belief system. And so it's completely sensible. You say, oh, be careful at the end of range, or hit yes, neutral spine, you know, co-contract when you do this stuff. That was our belief system. Some of our early research, so Wim Danker's research, we're looking at these people going, we're looking at people with pain who weren't in pain, and looking at people in pain and going, wow, what we're seeing is they don't have a lack of stability. They're way co-contracting. So these people are like working the multifidus like crazy. They were bracing their transverse abs when they were doing this stuff, and they were telling us it hurt. And the more we did it, you know, the interesting thing that you touch on there, I think stabilization exercises become, for people who are frightened, what's called a safety behavior. It's something they do to make them feel safe, but it actually doesn't take them back. You know, it's not normal to protect something when you use your body, right? It's normal to have free, careless, joyful movement. But in fact, I think a lot of rehab reinforces hypervigilance and these safety behaviors that actually leave people quite trapped. I can think of numerous patients where I've done that, and they've come back going, you know, I don't feel good with these exercises. And I'm looking at them going, you don't look good either.
Boy,
So I think Peter O'Sullivan brings up a really good point here that kind of resonates with the previous quote. If people are tight and they're guarded and they're protected, why would we want to force more exercises and movement patterns on them that are highly restrictive and keep them tight and protective and guarded? A really good analogy to understand why some of these muscle changes might happen when you're in pain is to realize that pain is actually a protective mechanism, and you experience pain when your brain and your nervous system thinks that you need to be protected. So if you were walking through the woods in the middle of the night and somebody jumped out from behind a tree and yelled boo, you would probably jump and you would probably tense and tighten up your muscles, right? So that tightening up that happens is a protective mechanism because you're scared. If you're experiencing low back pain, that means that your nervous system is actually a little bit scared. It's a little bit worried of what it thinks might be going on. So, of course, the natural response would be to tighten up, to try to protect you, to try to guard, to try to stay on edge all the time, just in case something bad is about to happen. So, taking the opposite route of creating more stiffness and more tightness in the system by doing highly restrictive exercises, we might be more beneficial and more helpful if we look at reinforcing free and nice flowing movement into pain-free or minimally painful ranges to help people build confidence back in their body, to build confidence back in their spine, and let their nervous system know, let their brain that's trying to protect them know that it's okay and it's safe for them to move into those ranges of motion. So what are the take-home messages regarding what we see for people in back pain? People in back pain appear to move differently. This movement is usually characterized by less variation, less movement, increased stiffness in the way that they move. There's often a change in the way that muscles function, but this change is likely to be an effect of the pain rather than a cause of the pain. So the pain is leading to the muscle changes rather than the muscle changes leading to the pain. So people with back pain have often developed fear avoidance beliefs and fearful movement patterns. So you move less and you become more fearful of moving because you've learned that it hurts when you move. So breaking out of those patterns is going to be highly valuable to actually reducing your back pain and restoring normal movement. And beliefs of core instability and weakness can spur maladaptive beliefs about the back. And there's just a plethora of research coming out to date that shows that fear avoidance beliefs and maladaptive beliefs about the back, or thinking negatively about your spine, thinking that it's unstable, thinking that it's not robust, actually is a strong predictor for future back pain and future disability and chronic low back pain. So there's a guy named Ben Darlow, and there's a bunch of other people that are looking at the words that we use when we explain what's going on to somebody when they have back pain, and the way that we explain that, whether it's in a threatening manner or in a de-threatening manner, your back is just a little bit stiff and we need to get it moving confidently, versus your back is highly unstable and we need to strengthen you because you're very weak, kind of imparts a different thought process into that person, which actually leads them to more pain and more protection, or less pain and less protection. So if core exercises don't seem to be all that special, what do we do for back pain? And I think I've already kind of hinted at that so far. We still exercise, but now we have a really, really wide range of things we can do. We don't have to focus ourselves into core stabilization exercises, which we know in some cases absolutely can be good. So we can still do core exercises, but maybe we change what we tell people about their core being weak or unstable or needing to become more stabilized with core stabilization exercises to reduce their back pain. Maybe we can do some Pilates, we can do some yoga, we can lift weights, we can walk, we can jazzercise, you can prancercise, you can do group fitness classes, you could run, you could play a sport that you really enjoy. Moving and exercising can help us build confidence in our bodies, and that might be one of the keys to recovery rather than fixing some sort of underlying muscular problem that we've already seen the research doesn't support. So sometimes we need to move more. One of the greatest predictors of an acute bout of low back pain is actually sitting for longer or staying stagnant with your movement for longer than 6 hours. That's a big predictor of acute back pain. Boeing did a study in the 1980s that showed that those people that were most likely to have back pain at work and miss days at work, it wasn't because they were lifting heavy weights. It wasn't because they were doing a lot of activity. It was actually because they were unhappy at their job. So this directly shows the relationship between stress, unhappiness, and depression with the onset of back pain, which there's an immense amount of research coming out on this idea that back pain actually has a huge psychosocial component, meaning how you think and how you feel in your social relationships actually might create a stress response in your body, or your brain might perceive a little bit more danger because of these things and lead to a more of a protective response that is exemplified by back pain. So when we aren't exercising and moving regularly, our body can become less able to handle stress, and it can become a little bit less resilient. Just think about if you are used to working with your hands and you have some nice calluses and strong hands, and then you aren't able to work out in the garden, or you aren't able to work with your hands for several months. That first time you go back out to do some gardening, your hands might become a little bit sore or sensitive, or you might even get a blister, because your tissues just don't have the capacity that they did. But if you're regularly moving, if you're regularly exercising those tissues, they develop a greater capacity for activity, and they're much less likely to hurt. We can take it a layer deeper and even look at the fact that exercise is somewhat anti-inflammatory globally throughout the entire body. So we can see this in cardiovascular disease, we can see this in metabolic syndromes, we can see that doing exercise actually has strong anti-inflammatory effects that counteract some of the inflammatory effects that go along with cardiovascular disease and metabolic syndrome and those sort of things. So we can strengthen up our tissues and have them become more robust, and then we can make our bodies more anti-inflammatory by doing exercise. Not to mention, exercise is also really good at releasing chemicals into your bloodstream that are known to be pain reducing, such as your own endogenous opioid system. So you have a little medicine cabinet in your brain, and when you exercise, you tap into that medicine cabinet and you release lots of feel-good hormones and neurotransmitters into your bloodstream that also help to reduce pain. Sometimes we need to move less as well. You could be sitting here watching this and thinking, man, I'm really active, I exercise all the time, yet I still have back pain. Maybe you're actually overdoing it. Maybe you've worked your hands, you're quote unquote, you've worked your hands too hard and you've overworked those calluses, and you have some tissues that maybe you need to back off just a little while and let them heal up and become more robust. Or maybe your system is just overloaded. There's a nice analogy that has to do with a glass and water. And you could imagine that you are a glass, and everything that you do and experience is water going into the glass. So if you don't sleep well, if you exercise too much, if you have some stress, if you have some anxiety, if you have poor nutrition, if you're not well hydrated, if you are depressed, a wide variety of things put water into that glass. And once that glass becomes full and overflows, that's when you might experience pain or an injury. So sometimes it's about backing down how much water you're putting into the glass to allow it to kind of drain out so you can withstand more activity without having a flare-up of pain in the future. And every now and then, we just need to move differently. We saw that people with back pain actually tend to move in a very restricted manner. They seem to be very stiff. They don't have a lot of variability. So instead of putting on the disguise like the duck in this picture to try to act like the pigs, maybe we should just move a little bit differently. We should break out of our predetermined patterns of what we think is supposed to be good for back pain, like core stabilization exercises. We could be doing ourselves more harm than good occasionally if we are forcing ourselves into exercises that we think are good for us, but they're actually facilitating the problem of protection and guarding and decreased variability and increased stiffness. So the take-home message is there is no magic bullet treatment for back pain, and there's nothing that will work for everybody. Every human is different, and some people will respond better to certain types of exercise, and other people will respond better to different types of exercise or manual therapies or lifestyle adjustments. There's no magic bullet. There's no one cure-all. There's lots of different types of back pain, and there's lots of different types of exercise that are beneficial for back pain. No one exercise seems to be superior, and it might be more important that we focus on the human being attached to that back rather than just the back. So exercise that people enjoy and it's easy for them to do, to work into their everyday life, is probably going to be a lot more beneficial and have a positive effect. If you ask a mom, a stay-at-home mom of 4 kids, to do all these high-level gym exercises when she doesn't have access to a gym, you're probably not going to have good results there. So we need to make sure that we're tailoring the best exercises to the person that actually are able to get done, and that fit their belief system and that fit their lifestyle. So we need to make sure that maybe we explore taking, lots of different vitamins, lots of different types of exercise. Maybe we focus on, high load exercise, or maybe we focus on low load exercise, depending on the person. Maybe we want to work on strength, or maybe we want to work on their power, maybe control, maybe endurance. Maybe we just want to work on flexibility and fluid motion. We need to figure out what specifically that person in front of us needs and work on those different areas, so we can be a little bit more specialized and unique to whoever is experiencing back pain, rather than just automatically making people do core exercises. I want to reiterate that the positive effects from exercise for low back pain may not be, and probably aren't, attributable to the measures of strength, the measures of flexibility, the measures of muscle onset timing. It's likely that the act of exercising is much more beneficial than the specific exercise itself. So, final take-home messages: structural factors such as lumbar lordosis angle, pelvic tilt, and leg length discrepancies, and muscle length and muscle onset firing time, and all of these sort of things don't really seem to be that relevant for back pain. But we shouldn't focus on those, and we shouldn't tell people about those. We know that people who feel the need to protect their backs usually have worse outcomes. So, and if we facilitate that, that could lead to worse outcomes as well. And finally, we know that decreasing stiffness and promoting freedom and variability of movement is probably a really good goal in the rehab of back pain, especially for those people that are displaying some fear of movement. So most of all, we need to have fun. We need to make exercise fun for people with back pain, and we need to meet them where they're at to help them get moving in a way that really reflects what they enjoy and reflects what they believe will help them as well, without pushing them down the pathway of thinking that their core is unstable or that their trunk muscles are weak, which is leading to this problem with spinal instability, because the literature just does not support this at all. So I hope that you guys enjoyed this presentation. I hope that it was helpful for everyone, and I hope that you will pass it around and get as many people to watch it as you possibly can, because it's such an important message to get out to the general population, to get out to the public, to promote the idea and the understanding that back pain is a lot more complicated than just some muscles, that your spine is not unstable and in fact is really strong, and that it's very unlikely that your core is weak. And even if your core is weak, it's very unlikely that that is actually the cause of your back pain. The back pain is multifactorial and has a lot to do with your stress levels and your psychological and social status, as well as what might be going on in your body. So again, thank you guys for listening, and I hope you'll spread this around.